would like to begin by thanking UT Health San Antonio for the opportunity to talk with all of you today about advanced care planning. This is a topic that I'm very passionate about, and I appreciate you all taking an interest in learning more about it today. I certainly wish that we could all be together in person today. I was very fortunate to live in San Antonio on and off for about 16 years. So the people and the culture of South Texas, as well as the Health Science Center, will always be a special place for me. So I do understand that for this webinar, we have a mixed audience of community members, including many older adults, as well as healthcare providers, all with diverse backgrounds. So I am hopeful that each of you will take away some practical information that will be of value to your unique circumstances. My goal today is to provide a general overview of advanced care planning, to talk about the impact of the COVID-19 pandemic, and then racial and ethnic disparities on this process. And then we'll conclude by examining resources that are available to help support you with advanced care planning. There are some essential elements of the advanced care planning process, and we'll take a closer look at each of these throughout today's presentation, beginning with advanced care planning conversations. We'll also spend some time talking about the importance of documenting decisions in state-approved advanced healthcare directives. And then the third step, making sure that these decisions and the documentation are readily accessible and effectively communicated to family members and healthcare providers in a timely fashion. So as we begin, I think it's important to understand that advanced care planning is a process that allows people to discuss with their loved ones and healthcare providers their values and their goals for future medical treatment and end-of-life care, and then to document these preferences. The primary goal of advanced care planning is to ensure that an individual's wishes are honored at the end of their life, should they lose the ability to communicate these wishes or to make these decisions. Advanced care planning should begin when individuals are healthy, rather than at the time of a medical crisis. Unfortunately, many times advanced care planning does not begin until somebody is diagnosed with a terminal or life-threatening illness or injury, which then requires patients and family members to make complex, difficult decisions about their health care during highly stressful times when people are really in a very vulnerable place. So step one of this process involves engaging in meaningful conversations with those who are closest to you about what is most important to you as you consider future medical treatment and end-of-life care. These conversations should allow others to better understand what's important to you, to better understand your values, what makes your life meaningful. And I will share with you a little later in the presentation some resources that are available to help you initiate and continue these types of conversations. In addition to helping others understand what matters most to you as a person, these conversations should also focus on who you would want to make healthcare decisions for you if you no longer could. So for example, say you were impacted by a devastating stroke, or you were involved in a serious motor vehicle accident, or you were diagnosed with COVID-19 and found yourself in an intensive care unit needing a mechanical ventilator. Who would you trust to make decisions for you And is that person comfortable making these types of decisions for you? Conversation should also focus on your preferences for life-sustaining treatment, and I'll provide some examples of what I mean when I say life-sustaining treatment. And then finally, these conversations should not occur only one time. Decisions may change, and so it's important for you to talk with your family members and your healthcare providers about how frequently you're going to revisit these decisions. So once you've engaged in these conversations, it's important to document these decisions in state-approved advanced healthcare directives. So completing advanced directives is therefore step 2 of this process. And in the state of Texas, advanced directives consist of the medical power of attorney and the directive to physicians and family or surrogates. So the medical power of attorney, as many of you know, is that person that you assign to make healthcare decisions for you when you no longer can. You may hear this person referred to as a healthcare agent or as a surrogate decision maker. And some states use terminology such as healthcare proxy or durable power of attorney for healthcare. And I know that that can cause some confusion, especially if you do have family members living in different states. And then the directive to physicians and family or surrogate allows an individual to document if they would want life-sustaining treatment, or alternatively, if they would want treatment focused on comfort. Now, it's important to keep in mind that these directives are only valid if somebody is diagnosed with a terminal or an irreversible illness, and that an individual can change or revoke an advanced directive at any time as long as they retain decision-making capacity. So let's talk a little bit about the types of interventions that are addressed within advanced directives. And again, this varies by state. So Texas, their advanced directive forms are rather broad. So they'll ask you to decide, again, whether or not you would want life-sustaining treatment or if you would want treatment focused on comfort. So life-sustaining treatment is any intervention that helps to support the functioning of a vital organ when that organ is no longer functioning naturally. So if, for example, a person's heart stops beating, would that person want CPR, cardiopulmonary resuscitation? If somebody is diagnosed with pneumonia or acute respiratory distress secondary to COVID-19, and they are no longer able to breathe on their own, would they want to be placed on a mechanical ventilator? Some states, such as Pennsylvania, where I'm living now, list very specific interventions within their advanced directive forms. For example, dialysis, chemotherapy, radiation, medically provided nutrition or hydration, and sometimes you'll hear that referred to as artificial nutrition and hydration. Again, remember, we're talking about these interventions in the context of someone who has a terminal or an irreversible illness. And they also need to be considered in the context of a person's specific goals of care. So these are the types of interventions, the types of decisions that should be included in advanced care planning conversations that you're having with your family members and your healthcare providers. It is also important to understand that the decisions that you document within advanced directives oftentimes need a medical order in order for them to be implemented or carried out. So if, for example, you are diagnosed with a terminal illness, or a family member is diagnosed with a terminal illness, and they have decided that they would not want CPR should their heart stop beating, that information needs to be communicated to your medical provider so that they can write a medical order, a do not resuscitate order, so that your wishes can be honored. As many of you know, when you are admitted to the hospital, the nurse will ask you if you have an advance directive. And if you do, they'll want to obtain a copy of it. They'll want to know who your medical power of attorney is and verify the contact information for that person. At that time, your medical provider should be reviewing your wishes as outlined within your advance directive. And if there is anything that requires an order, it should be implemented at that time. You may also hear about a form called the Medical Order for Scope of Treatment, or the MOST form. This is an order set that some providers and institutions within Texas utilize. And this order set travels with a person across settings. So from the inpatient hospital setting to outpatient settings, such as a long-term care facility, and is also valid in homes. So this is a form that you may hear about in advanced care planning conversations that you're having with your healthcare provider. Know that this form or this order set is only appropriate for individuals living with serious or advanced illness. Another really important aim of advanced care planning is to ensure that you have all of the information that you need to make what we call an informed decision. And so in order to do this, you really need to partner with your healthcare provider. We want to make sure that individuals have a good understanding of their existing medical conditions, if they have other chronic illnesses, how those chronic illnesses relate to existing medical conditions. What is the expected course of those illnesses over time? It's also really important for people to understand the risks and the benefits associated with treatments that are being recommended. And if they are not interested in a certain treatment, what are the alternatives to that treatment? And what are the risks and benefits of those alternative options? All of this information will be considered in the context of your specific goals of care. So I'm hoping that many of you have completed an advanced directive. I'm hoping that some of you have engaged in advanced care planning conversations. But I know that for some of you, this may have been many years ago, and some of you may be listening, wondering if this is really important, especially if you're young or if you are not living with any serious medical illnesses, or you haven't had a friend or a family member diagnosed with a serious medical condition. So again, I want to spend a little bit of time talking about why advanced care planning is recommended. It certainly helps to promote autonomy, which is an individual's right to make their own decisions about their health care. And that's something that many of us value in the United States. At the same time, we know that there are families and groups that may not prioritize personal autonomy. These groups may value family cohesion, family decision-making over the well-being of any individual within a family unit. The good news is that advanced care planning, as we're talking about today, should also help to promote those values. So advanced care planning helps to ensure that the care a person is receiving is aligned with their personal, their cultural, religious, spiritual, and family values. It should also help to minimize family conflict, to reduce potential feelings of guilt or confusion, and to reduce distress. So these are all emotions that can result when a family member is required to make decisions for a loved one, and they're not really sure what those decisions should be. So their family member has not documented their wishes within an advance directive, or they haven't sat down and had a conversation. So oftentimes family members feel conflicted, and these emotions can sometimes persist for many months, sometimes years after a loved one has died. And they can result in what we refer to as complicated grief for the surviving family member. So although there are many well-known benefits to advanced care planning, there's still a significant number of Americans who have not engaged in this process for a variety of reasons. A recent large study found that only 36% of adults in the United States had completed an advance directive. A survey published by the Conversation Project found that while more than 90% of people recognize the importance of discussing end-of-life wishes with families, that only 32% had engaged in these conversations. Yet 53% of Americans report that they would be relieved if one of their loved ones initiated such a conversation. So there's this disconnect between what people want and what is actually happening. And there are a number of well-established reasons why individuals do not engage in advanced care planning. It may be that your healthcare provider is reluctant to initiate advanced care planning with you. And that could be that they don't feel experienced. They may not feel that they have the knowledge or the skills to navigate these complex, difficult conversations with you. And this is something that we have recognized in healthcare. And over the last several years, we're trying to provide additional education and training to doctors and nurses and social workers working in all specialties so that they feel more comfortable facilitating these conversations. Your healthcare providers oftentimes worry that bringing this topic up may make you feel as if we're giving up on you. We don't want to take away your hope. And so for that reason, healthcare providers are sometimes reluctant to initiate advanced care planning conversations. It also can be difficult to make theoretical decisions about something that may or may not happen in the future. We also know that in some instances, people have a fear of talking or thinking about death and dying. They worry that thinking about end-of-life issues may cause something bad to happen to them or to someone that they love. So that's another barrier. State laws, again, vary, and so that causes some complexity that can contribute to confusion, and we'll talk about how we can provide assistance to help minimize some of that complexity and confusion. And then finally, some of you may have specific cultural or religious values that you feel conflict with end-of-life decision-making, such as the withdrawal of life support. So we really encourage people to consult their religious, their spiritual advisors, so their priests, their rabbi, pastors, chaplains, to include them in this decision-making process, include them in these types of conversations. So let's now talk a little bit about the impact of culture on advanced care planning. Again, I know that South Texas, San Antonio is an area that's really rich in culture. In Latino and Hispanic populations, we know that there are many cultural beliefs that may impact views on advanced care planning. So as healthcare professionals, it's really important that we are aware of these cultural beliefs. And it's also important that we create an environment, we create spaces so that individuals feel comfortable disclosing or sharing these beliefs with us. So, for example, respect for authority. An individual may be very reluctant to question a physician's treatment plan or disagree with a treatment recommendation. Understanding how the use of language and history impact trusting relationships and personal interactions is really important for us to consider. Knowing that some individuals prefer to focus on the present moment rather than the past or the future, perceiving that they have little control over future events, that idea is really relevant to advanced care planning. We need to take some time to understand the hierarchy of decision making within a family, who's ultimately responsible for making decisions about a family member's health care. And then again, awareness that in some cultures, discussing death and dying is sort of a taboo topic. People worry that discussing end-of-life issues may be a precursor to future misfortune. So I'll admit, I worked as a nurse in San Antonio for many years, and I was not aware of many of these cultural beliefs and how they may have been impacting the care that I was providing to my patients and their family members. So this piece is really important. And we want to empower you to share your beliefs with other members of the healthcare team. So it certainly is beneficial for individuals and healthcare providers to facilitate advanced care planning in a way that is culturally sensitive and to address barriers. So we know that racial and ethnic disparities in advanced care planning do exist. Individuals who identify as Black or Hispanic are less likely to have completed an advanced directive or to have participated in an advanced care planning conversation with either their family or their healthcare providers. And we know that these differences persist, even in individuals living with cancer. And this matters because individuals may not be receiving care that is aligned with their values or their preferences. For example, patients may be receiving more burdensome care at the end of their life. They may be less likely to receive supportive services, less likely to receive hospice. They may be more likely to die in an intensive care unit rather than to die at home surrounded by family and friends. So there's a variety of factors that contribute to racial and ethnic disparities in advanced care planning. And I think it's very important to acknowledge up front that these factors largely result from systemic racism. And they include distrust, so distrust of healthcare professionals, distrust of the healthcare system, language and cultural barriers, issues surrounding poverty, lack of access to technology, and then limited awareness of advanced care planning, not necessarily understanding the purpose of advanced care planning or the benefits of advanced care planning. And so as healthcare providers, we need to ensure that we are delivering and facilitating advanced care planning in a way that is meaningful to these groups. So the COVID-19 pandemic has certainly highlighted health disparities for these groups. And the COVID-19 pandemic has also magnified the importance of earlier and ongoing advanced care planning for all Americans. So as of January 2021, Texas had the second highest number of cases and the highest number of deaths from COVID-19 in the United States. So I know that some of you may have been intimately impacted by COVID-19. It most likely made it more difficult for you to see your family members and friends who had been hospitalized. You weren't able to sit at their bedside, have a conversation with them, assist in decision making because of isolation precautions and visitor restrictions. So this has been a really difficult time. And if a patient had been confronted with really making a complex decision about whether or not they wanted some type of a life-sustaining intervention, it became, difficult. There's not as many healthcare professionals during times of the pandemic to have these conversations. There's not as much time to have these conversations. Rather than sitting at the patient's bedside, these conversations are now occurring remotely over the telephone, via FaceTime, in some cases via telehealth. So again, this pandemic has really magnified the importance of having these conversations and making sure that these decisions are documented before someone becomes acutely ill and is hospitalized. As many of you know, the COVID-19 pandemic, or the early days of the pandemic, highlighted an increase in the number of cases, hospitalizations, and deaths for people of color. And these are the same groups who have been less likely to participate in advanced care planning. Again, largely because of differences in access to opportunities and resources. So this is something that's important for us to address and think about resources that we can provide and ways that we can facilitate this in a way that is most meaningful and effective for these groups. So we know that older individuals with pre-existing illnesses are more likely to die from COVID-19. However, in the United States, people of color are dying at higher rates and younger ages of COVID-19 compared to non-Hispanic whites. So again, it's never too early for us to begin this process of advanced care planning to ensure that all patients' wishes are honored at the end of their life. So the good news is that since the onset of the pandemic, we have seen an increase in advanced directive completion. And there are a variety of resources out there that can help to support you in initiating and continuing these conversations and help you to document your wishes. So I want to spend just a little bit of time sharing with you some of these resources. So the first is the Conversation Project. And this initiative was built upon the idea that these types of conversations should be occurring around the kitchen table and not in the intensive care unit. So the Conversation Project, which you can access via this link, offers multiple starter kits in multiple languages including Spanish, that helps you begin these conversations. They also offer a starter kit for families who have been impacted by dementia and Alzheimer's disease. And they also provide resources for you to navigate COVID-19. And again, if I did not mention it, these resources are free for you to use. Prepare for Your Care is another program that was established back in 2008. It offers step-by-step video stories that again help to support you through the advanced care planning process with easy to read written materials. It also has materials available in multiple languages, including Spanish. And it also provides resources on how to navigate technology, how to use a computer, which is oftentimes required to facilitate advanced care planning in some healthcare institutions. Our Care Wishes is a program that was developed by Penn Medicine here in Philadelphia. And this is a program that allows individuals to express their thoughts on quality of life, on their specific goals of care, on how they would like their life to be celebrated, what they would like their final days to look like, among other resources to support advanced care planning. And then the Hello game is a card game that an individual can play with their own family. They can play with small groups of friends or colleagues at home, in community, work, church settings. And this card game allows you to begin to explore issues related to end-of-life care in sort of an informal, non-judgmental way. So there's been lots of research conducted with this Hello game, and a recent study that was published by Penn State College of Medicine found that a group of African American participants who had played this game in multiple community settings, that there was a 40% increase in completion of advanced directives after having played the game. And more importantly, that about 80% of participants went on to actually have conversations with their family about their end-of-life wishes. So again, this is just a select few resources that are available for you. There's many others out there. There's other card games. And I think it's important for individuals and families and groups, that are affiliated with churches or other community organizations to take the time to explore these resources and determine, which one works best for me or for my family or for my group. And again, there may be things that you're doing in your own communities or your own churches that are already working effectively for you. So I'd like to share with you now a short video that was developed by the Conversation Project that really helps to summarize much of what we've been talking about today. That started from the beginning.
I was going through my mother's own last years, months, days of life. We had never talked about her wishes for end-of-life care. From time to time, she would say something like, if I'm ever like that, pull the plug. But of course, when she became ill, there was no plug to pull. And also my mother had dementia at the end. So we were not able to have any conversation about what her wishes were. So I was her healthcare decision maker. And in the last months, years, really, I had a cascading number of decisions to make for which I assure you, I was totally unprepared and in fact, blindsided. What I learned from the experience of talking about my mother's end of life is that, guess what? This experience is far too common. Far too many of the people we love are not dying in the way that they would choose. Far too many of their survivors are left guilty, depressed, uncertain about whether they have done the right thing. 70% of people say they want to die at home, and 70% of people are dying in hospitals and institutions. That's just a huge disconnect between what people wish and what happens. We can change that. That's why the Conversation Project emphasizes having a talk about values, about what matters to you, not what's the matter with you, but what matters to you, and what's important for you to think about at the end of their life. Are you a person who wants all the information, or do you want just enough? Are you someone who is going to make all decisions for yourself, or do you want your family to be involved? What's important to you at the end of life? Then you've given them a real staff, a guide. We started the Conversation Project with just a small group of people around a table. When we sat down, we brought in experts in the field, and it was the experts in the field who told us that if we're going to change the way people die in America, we have to go outside the medical system and change the cultural norm from not talking about what we wanted at the end of life to talking about it. One of the things that the conversation does is tell your parents that you're going to be there for them, that you're not going to leave them isolated in the hands of strictly medical people. The medical community is just beginning to be conversation ready. A generation ago, we transformed how people were born. It was not the medical profession that said, come into the hospital with your video camera, let's have a baby in the bathtub, and don't all the husbands want to come into the birthing room? It was not, I assure you. Birth is a human experience, not just a medical experience. And part of what we're doing in talking to people is recapturing and saying, dying is part of the human experience. It's part of a natural progression in life. We have the capacity to transform how people die in this country. I think everybody does have an idea of what a good death would be. When you ask people, the word that comes up the most is peaceful. The Conversation Project is very much about connecting. It's about sharing, and it's about being open and loving to each other through a very difficult journey.
Okay, so once you've begun these conversations, you've begun to write down your wishes. As we discussed earlier, it's really important to document these decisions in state-approved advance directives. And so you need to know where to find these forms. And so certainly healthcare professionals can assist you with that piece. Again, when you get admitted to a hospital, the nurses are legally responsible for asking you if you have an advance directive. And if you don't have an advance directive, or you're interested in completing an advance directive, then we need to be providing you education on that process and access to the forms. So in addition to healthcare professionals, lawyers specializing in this area, for example, an elder care or an estate attorney may be able to assist you in locating advance directive forms. Community organizations can be very helpful. So for example, the Alamo Area Agency on Aging can provide support, in this case for individuals over the age of 60. Organizations such as AARP oftentimes have links to state-approved advance directive forms. And then you can also find Texas Advance Directive information on the National Hospice and Palliative Care Organization Caring Info link, which I've included for you on this slide. So as I discussed earlier, the process can be a little overwhelming. In some cases, these documents can be close to 20 pages. So do not hesitate to ask for assistance from a healthcare professional, a lawyer, a benefits counselor, a neighbor, a friend from church. You certainly are not in this process alone. I've just included sort of a snapshot of some of the language that you might see on an advanced directive form on this slide. So for example, in order for your medical power of attorney to be valid, that signature does need to be witnessed in the state of Texas by a notary public or in the presence of 2 competent adult witnesses. And of course, there's multiple criteria of who that person can and cannot be. So it's important that you're sort of aware of the sort of rules and regulations that are guiding this process. But again, this is where other people can step in and sort of assist you with making sure that you're completing this documentation correctly. Okay, so we've spent a lot of time talking about having these conversations and again, documenting our wishes. This step 3 follow-up is probably, just as important. We need to make sure that these decisions, this documentation is again, readily accessible and effectively communicated to family members, to friends, to healthcare providers, so that our decisions are honored. When you complete your advanced directive form, there will be an area on the form that asks you to indicate who you've given copies to and where you're storing copies. We really recommend that individuals make multiple copies. Certainly, the medical power of attorney should have a copy of your advanced directive forms, your living will. You can share them with other close family members. Your primary healthcare provider should have a copy, as well as any specialist that you see on a regular basis. So if, for example, you see a cardiologist for your coronary artery disease or your heart failure, they should have a copy. If you routinely see a pulmonologist for COPD, they should have a copy. Many of our healthcare institutions are now integrated, so they should have integrated electronic health records. But we don't want to make an assumption that just because we've shared this information during one hospitalization, that everybody who needs this information is familiar with it. We really want to make sure that we're advocating for ourselves. You should keep the original in a place that is accessible to other people. And again, it's important to keep in mind that you always have the right to change your advanced directive at any time. What's most important about that is that if you do change your advanced directive, that you ensure that everybody has updated information. So my goal today, again, was really just to provide you with a general overview of advanced care planning, to talk a little bit about how the COVID-19 pandemic has really magnified the importance of us doing earlier and ongoing advanced care planning, the importance of addressing barriers to advanced care planning to minimize racial and ethnic disparities in this area, and then to share with you some resources that you can explore to see if any of them will work well for you. I certainly hope that this was just the beginning of a conversation and that you will continue this conversation with those who are closest to you, as well as your healthcare providers. And understand that advanced care planning is not really talking about death and dying. It's not really just talking about end of life. It's really talking about how you can honor those who you love the most. So I want to thank you all again for taking an interest in this topic, and just conclude by recognizing that this project was submitted by a HRSA grant. Thanks so much.